This is a paid program. JJ Publicidad, EMR, and its owners and associates take no responsibility for the opinions or statements made by the talk show host or their guest.
Are you looking for awareness, motivation, inspiration, or just some feel-good talk radio? If so, you've come to the right place. Dr. Nancy knows how to do just that. With her extensive experience and knowledge, she is dedicated to providing care, health, and wellness information and education to the greater Phoenix metropolitan area and beyond. Be the change you wish to see in the world. Dr. Nancy knows. Starts now.
Good morning, everyone. I'm your medical celebrity doctor, and this is Dr. Nancy Knows Radio Talk Show. How is everyone doing today? It is January. We are well into this month. Happy New Year 2021. You know, here, we are so grateful to have an audience and viewers that tune in every morning, Saturday mornings at 9 a.m. to listen to topics that are relevant and that are impactful to you all in your community. This is the show where expert guests in their field of industry and celebrities come on this show and talk about what they're doing to give back that's so impactful. Dr. Nancy Knows, as you know, is multicultural. It's a platform that bridges the gap of disparity, and it unites our nation. And, you know, we give back, and as we all should do as a nation, these are troubling times that we live in, and coming together and sharing love and providing hope is free. I'd like to thank my sponsors because I'm just so grateful to be able to bring this broadcast to you every Saturday, and I wouldn't be able to do it without them. So I'd like to thank, first and foremost, EMR, Emotion Radio, Entre Mujeres. This is the platform in which I am delivering information to you all today. Thank you, thank you. Thank you for our paid sponsors and supporters like Sonoran Oral Maxillary Surgery, our folks there, and also Maggie's Makeup. If you all like how I look every Saturday morning, it is due to my colleague, my team member, Maggie Gorin, Maggie's Makeup. It takes about an hour to do, and she is phenomenal. She's for hire as well for any types of events that you may be having, and she is a licensed makeup artist. So whatever occasion it is that you may have, she can accommodate very well. Thank you, Maggie. Our friends at RN Electric, thank you so much for your support. Profit Laser Lipo, Gary Charlson. Thanks, Gary. And listen, we are brought to you live every Saturday morning on Emotion Radio, Facebook Live, Dr. Nancy Knows, Facebook Live, drnancyknows.com, streaming live to you every Saturday morning at 9. We love you all. Thank you so much. Let's talk about current events. Now, there has been some troubling times, as I've mentioned before, and this week has been extremely shocking. Our Capitol was stormed, and we don't condone that behavior, and we as a nation need to come together and unite. And I pray for the lives that were lost this past week. We pray for their families as well. We should all pray as a nation to come together and make a change. Be the change you wish to see in the world. It really only takes one, the power of one. Let's talk about COVID. COVID has affected many lives, not here just only in the United States, but worldwide. Let me give you some statistics. Here in the United States, over 22 million cases of COVID has been reported. There's been over 378,000 deaths in the United States. Worldwide, over 89 million cases and 1.9 million deaths. The COVID vaccine is here, everyone, and there has been emergency use authorization that's been granted to pharmaceutical organizations, to name a couple, Pfizer and Moderna. Now, those vaccines are going to be delivered in 2 doses, and they do require special refrigeration. Now, the vaccine is proposed once an individual gets the vaccine, it allows their body to make their own antibody, immunoglobulin G. IgG is the good antibody that builds up immunity to COVID. Now, there are other pharmaceutical companies that are granting or seeking authorization through the FDA. And specifically, I believe it's AstraZeneca that is coming out with a vaccine that is one dose to get the effectiveness to combat COVID. So stay tuned for all of that. Now, the CDC is recommending that their goal is to vaccine 20 million individuals by the end of the year. Now, we do know in current events that COVID, it's mutating. Initially in the UK and now here in many states in our country. And public officials do state that the vaccine should be enough to build up immunity for COVID in its mutation phases as well. New year, new you in 2021. There are many people that make resolutions. Some make words for the year. And I was going through my Facebook feed, and one of my Facebook friends had developed a word and came up with a word for the year. And she challenged me. I felt challenged and compelled to do the same. And her word was expansion. And she wrote the many different ways that that word would be instrumental in her life this coming 2021. So I challenge you all to come up with a name or a word that would hold you accountable, and in a healthy way, of course, to accomplish the goals that you set for yourself each and every day as we matriculate through 2021. My word is ignite. And I use that word because I multitask, and there's a lot of things, moving parts in my life that I'm really grateful for. And Ignite it's going to be a wonderful year. I believe it to be for all parties if we all believe. You have the power to change and make a difference in your life. And what we do here at Dr. Nancy Knows Radio Talk Show is that we instill inspiration and motivation. And we'd like to know and like to let you know that we are here for you. So listen, we do have a guest that's coming up later on our segment, and she is phenomenal. She is a doctor. She has a clinical doctorate in pharmacology. Dr. Sharzad Green. Dr. Sharzad Green will be on the show a little bit later in the next segment to give us some helpful tips on menopause and hormonal imbalance and sexual dysfunction, adrenal fatigue, and nutritional supplements. And, often individuals say menopause, yeah, that is a woman's disorder, but Dr. Sharzad Green does work with both men and women, as, we do get wiser in life, and we can often have some hormonal imbalances that can interfere with our health and mental well-being. And so she is up next. So get your questions ready, because we can answer, and we'll be able to answer some of your questions if you go to Facebook Live and type in those questions that you all may have. Dr. Green will be standing by. The other thing I do want to talk about, New Year, New You, is best diets. The best diets out there are Mediterranean, flexitarian, the DASH diet, as well as Weight Watchers. And you know, Dr. Nancy's integrative medicine has health screenings. She does them all year long, and it's a great time to start this year to get a physical examination, to include blood screening, baseline blood screening, and it's a really great time to start the year off right, to see what improvements that you can make in your life, because we do want to be the best for ourselves first and foremost, so that the overflow can go to other individuals that are in your life of importance. Remember, there's no time like the present to make a difference. And the new year is a new year, and it's just that. You can make a change. You can improve in who you are to others at any given time, and we're here to encourage you in that way. One other thing I did want to let you all know is that there's a county in California that is instituting crisis standards of care, and our healthcare professionals, and I do want to shout those individuals out, our first responders, are impacted in a major way in our hospitals. And, you know, we're getting to a point in our country here that our medical care may be rationed in terms of who is most likely to survive. So everyone, do your part to practice social distancing, wear your masks, and stay at home if you don't need to be out, because our healthcare system is in crises right now, and we want to be there for all who need emergency care. Dr. Nancy's integrative medicine is here for you for multiple things, for bioidentical hormone replacement therapy, your health and wellness visits, as well as aesthetic health care needs. Yes, bioidentical hormone therapy. What is that? Well, that is a question that we will save for Dr. Green when she comes up on our next segment. But you would not believe how important it is to have a well-balanced hormone system and have good blood studies and a good gut, GI healthy system. It plays so much importance in cognition and just overall health and wellness as well. Be the change that you wish to see in the world, and it only takes one. Did you know that the highest population, this is a statistic out of the UN Population Division, in the year 2030, the highest population is going to be in the countries of China and India? Interesting fact, isn't it? Remember, we will be right back with Dr. Sharzad Green. She is a clinical pharmacist here locally to shed some light on the mysteries of menopause. And remember, it's not only who Dr. Nancy knows or what she knows, it's who she knows, and she'll be right back. We'll be right back after this.
You don't want to miss what's coming up next, because Dr. Nancy knows. We'll be back in a few minutes.
Hello, I'm your celebrity medical doctor, and this is Dr. Nancy Knows Radio Talk Show. We are looking for expert guests in their field of industry to include, but not limited to, finances, senior living, real estate, hospitality, entertainment, nonprofit, If this sounds like you, we want to hear from you. You can reach us at drnancyknows.com and fill out the form to be considered. Remember, it's not only what Dr. Nancy knows, but it's who she knows.
Hi, I'm Dr. Nancy. Welcome to our clinics. We believe that personalized care and relationship building are the basis of improving health outcomes. At Dr. Nancy's Integrative Medicine, you gain healthcare providers who take the time to understand your health goals and find solutions. We offer optional medical memberships, giving you peace of mind and quality care. We provide both medical and aesthetic services in 2 Arizona locations. We practice the highest standards of patient care. We respect patients' rights. We safeguard patient confidences. We treat patients with compassion. You are invited to call the office to schedule an appointment or online at a time that is convenient for you. Call to schedule 480-669-6452 or visit our website at drnancysintegrativemedicine.com.
Hello, this is Dr. Nancy's Integrative Medicine. We are offering health screening examinations to include a physical examination and blood work, such as CBC, chemistry, lipid panel, and A1C for $199, valued at $600 to the first 10 people who call 480-669-6452 or schedule online at drnancysintegrativemedicine.com by January 15th.
You're listening to Dr. Nancy Knows Radio Talk Show. Ask your questions now. Dr. Nancy is listening.
Welcome back and good morning. I'd like to introduce you to our next guest. She's an expert in her field of industry. Her name is Dr. Sharzad Green. She has a clinical doctorate in pharmacology. She has over 20 years of experience in the pharmaceutical compounding industry. She's a pioneer in bioidentical hormone replacement therapy, sexual dysfunction, adrenal fatigue, and nutritional supplements. She has been teaching for over 15 years and giving group and individual classes to healthcare professionals such as myself and also pharmacy colleagues. She has treated over 20,000 clients that have taken part in her services that she offers. She's an entrepreneur. She is a female doing it in this world, and I'm so super excited to bring her on and introduce her. She also has invented and created Fab-U-Vag, and it is all natural vaginal moisturizer for menopausal women. I'm so grateful to have Dr. Sharzad Green on with us today. Welcome this morning, Doctor.
Thank you. It's my pleasure to be on your show.
Thanks for having me. Thanks for actually taking the invitation. And, Dr. Green, you and I have met a little while ago, and I was so intrigued and interested in what you do. It falls, it's so in alignment of what it is that I do in my practice as well. And I'd really like my viewers and audience to get to know who you are, your background, and can you tell us a little bit about who you are outside of the expertise and what you do now?
Of course. I'm a pharmacist. I was born in Iran, and after high school, I moved to Tucson, Arizona. I attended the University of Arizona and went through pharmacy school there. I received my Doctor of Pharmacy degree in 1990. And one of the best advices that I received was never let yourself go stale. So I took that to heart, and after graduating, I started with retail pharmacy, but then I moved to home health and then long-term care, nursing home pharmacy, clinical. Then I met my mentor who changed my life, and I just fell in love with compounding and one-on-one consultation with women, and basically taking care of individuals the best that I could So that was about 21 years ago that I started doing that.
Wow. We often talk about on the show how important it is to have good mentors in your life. And this is a prime example of it as well. And, everyone has a story. And the truth of the matter is just never give up on your dreams, because you just never know how close you are to achieving those goals that you want. And it's so important to have individuals that edify you and support you and nurture you through your journey.
Of course, and sometimes it just takes a nudge from an expert with a lot of experience, because when I started doing this, I had my own pharmacy and compounding and giving advice to women especially. And then my mentor, who had a lot of experience, he observed me, and he's the one who recognized that I was actually making sense, and it was a service that was much needed. And he's the one who really pushed me into it. So I'm forever thankful to Lee McQuinn, who's, rest his soul, he passed away many years ago from Parkinson's. But it's always good to have a great mentor. And
Absolutely.
I actually promote being a mentor for others, and that's why I started teaching.
Absolutely. I totally agree with that, because it's often the individuals that have the experience that can see that special light and in that individual, the mentee, that kind of promotes what it is that you want to do and aspire to do. And oftentimes it takes some guidance and courage and motivation. And so at the end of the day, you can look back on who's been the most impactful in your life. That's wonderful, Dr. Green. Legacy. What legacy do you want to leave behind? Footprints.
Well, that's a hard one. I always live on the premise that live life with a passion. Whatever you do, you put your whole heart into it. And I want others to do the same. There are so many times that I see people who have so much potential, but they may not realize it or may not live up to it. So my legacy would be to basically don't give up on yourself and continue pushing forward, because you may surprise yourself.
Very good. Now, as a business owner, entrepreneur, that can sometimes come with many challenges. Any kind of advice from a strong female having a business, being an inventor and a creator of product and services? Any advice to individuals that are starting their journey?
First of all, I want everyone to know that nothing is perfect. I'm definitely not perfect. I'm far from being perfect. The same is, with my life. But at the end of the day, I always like to, I have a gratitude journal, which is just a notebook, and I write down a few things that I'm thankful for. And some days it's a little bit harder to come up with specific grand things to write about. So sometimes it could just be a soft pillow or my hand lotion. But basically, you've got to focus on the positive, and every day is a new day. You cannot let defeat bring you down and keep you down. You've got to get up and basically push forward. And maybe that comes partially from my immigrant mentality. I always instill that in my children, even though they've been born here. And I say, you've got to push forward. You've got so much potential. So you fail, yes. But if you didn't try, you wouldn't fail.
Well, that's very good advice, and I totally understand and agree with that as well. And sometimes you just have to really look at some of the small gifts that you have and you're grateful for each and every day, as well as learn to forgive yourself as well. That's really big, too. And it's not always the big grandiose things. It's sometimes the simplest things to be grateful for. So very good. So let's talk about, I have some questions about menopause in women, and what age does that typically affect individuals, and what are some of those signs and symptoms and things that can be done about it? That's really multifactorial, I know.
Well, for the most part, if you look at statistics, they show that a woman goes into menopause around age 51 or 52. In my practice, I've seen ladies as young as in their early 30s going into menopause. And I've got women who are in their late 50s and still menstruating and producing plenty of hormones. But the average age is about 51. The one of the biggest challenges that I see in a lot of my patients is the years leading to menopause. So 12 consecutive months with no periods means menopause, right? But before that, what happens? And that's a scary, it can be a dark time in your life, because you don't know where you are. One day you feel good and one day you don't. 1 month your hormones are functioning just fine and you get a period, and then 3 months goes by and you don't have a period. So during those few months, or few years I should say, leading to menopause, it's called perimenopause. Mm-hmm. That's when you've got to pay attention and start really working on your habits and become more healthy overall. Because the healthier you are, the healthier habits you have before menopause, the easier it may make it for you in the long run.
Well, that definitely makes sense in terms of your overall health and wellness, because speak to vitamin deficiencies or supplementations that could actually help benefit cognition and your overall health and well-being as it relates to some of these menopausal or perimenopausal symptoms.
One of the things that I emphasize on for women is you've got to take care of yourself before it's too late. Because how many times do we hear women say, well, I just had a bone scan and I discovered that I'm in osteoporosis. So if you're proactive, starting at age 35 or so, your bones start declining for the most part. You've got to take care of your bones. You've got to take care of your muscles. The stronger your muscles are, the stronger your bones will be. You've got to take care of your joints. Taking a good taking a good collagen is very important. You've got to get rid of those inflammatory cells in your body. So taking anti-inflammatories such as fish oil or resveratrol, things that are antioxidants, those are all really important. And I know there's a lot. Sometimes we get overwhelmed and we think, well, how many more things do I need to take? But when you look at it in the long run, if it saves you from having to go on pharmaceuticals and harsh medications with side effects, then it would be worth it. So I encourage women to actually take a look at their lifestyle, eating habits. You talked about diets. I don't really endorse any diet, because I really believe in doing a modification of your lifestyle.
That's right.
Eating whatever you like, as long as it's healthy, but portion control is really big for me. I always tell patients portion control, and that's what Weight Watchers is actually all about. So pay attention to your overall health before it's too late, before you hit 50, 51. So many of us experience weight gain at menopause. And that's something that we struggle with, especially women.
So that brings me to a major point as well. And there are all different types of learners and levels of motivation that individuals need, and some need more guidance than others. And you're absolutely right, generally speaking, and then specifically speaking. But overall, it really does take discipline. And, I do want to ask the question and make this comment about 3 primary things that an individual person, woman specifically, can do to help ease themselves into and or around that perimenopausal, menopausal period would be a good vitamin D supplement, a good fish oil, and perhaps even probiotics, right? Because we're talking about bones, muscle, anti-inflammatory, and cognition. So speak on some of those supplementations.
Well, I've been checking my patient's vitamin D level for as long as I remember. And to me, that's a really important thing. Vitamin D has been shown to help with so many different functions in our bodies, especially with bone health and your immune system. Your immune system plays a major role in your health. And more so now, there's more light shed on the immune system because we're all thinking about, well, we don't want to get COVID or get sick. So vitamin D is a very important one. And most of us do not really, our bodies don't make enough vitamin D because we're not either exposed to enough sunlight or we've learned to use sunscreens and protect ourselves. So it's very important for you to take a good vitamin D for a long period of time, meaning like, on a daily basis or on a weekly basis, a mega dose. But the key to that, either one that you take, is to have your level checked, because we don't want to blindly take vitamin D and get your level up to a toxic level. That's my advice on vitamin D. As far as the probiotics go, absolutely. Probiotics, there's so much research coming out about the effect of gut microbiome. Essentially, there's living organisms living in our gut, and they affect so much. They affect the absorption of things. And actually, our gut is, it's very important in producing some of the same chemicals that our brain produces. So you want to have a very healthy gut. And of course, when you look at probiotics, there are so many of them out there. You want something that's got a variety of strains and a good number of the bacteria, the good bacteria in it. And if you want specific recommendations, I'm sure they could ask you, or they're welcome to ask me, and I'd be happy to make recommendations. Awesome. And then the third thing that you asked me was about cognitive function. And I believe you mentioned fish oil, correct?
I did.
All right. Fish oil is one of my, I won't go anywhere without my fish oil. Let's put it that way. There are two ingredients in fish oil that are super important. One is EPA, one is DHA. I always recommend a fish oil that meets a minimum requirement of EPA of about 500 or 600 milligrams a day, and DHA of another 400 to 600 milligrams a day. Those are very important as anti-inflammatory. DHA specifically is super important for your mental function and mental acuity, very important. And surprisingly enough, there are some studies showing that a good fish oil could actually help with hot flashes and night sweats. And it could also help with depression. So many times we see women when they're going into menopause or during perimenopause, they experience depression. And I always recommend a good fish oil. I call this effect the Morso theory. So the Morso theory essentially tells people that whatever they are before menopause, they may become more so during and after menopause. If you're a depressed person, your depression may actually pick up and it may actually show more severely. If you're an anxious person, the same thing could happen. Therefore, it's important to utilize all the supplements or the natural ways to help your body to battle depression or whatever it is that you have. Along the same lines, another thing that I always recommend is get into the habit of giving yourself timeouts. You know how people give their kids timeouts to calm themselves down and collect themselves. Well, we stopped doing that as adults, but we really need to go back to it and meditate. Mindful meditation is a big part of your health. If you have a healthy mind, then your body will have a better chance of maintaining its health or getting back to health.
Well, that is really, really great information because, as we become wiser in life, get a little older, cognition capacity and memory does fade over time. And then, of course, inflammation, free radicals, that is a constant, we have constantly impacted on these free radicals and inflammation. And, you touched on how great a fish oil component is in your daily life and what the basic minimum requirements of each dosage of the DHA and EPA is. And if you have a supplement that is fish oil and it's not broken down that way, it's not guaranteed that you're getting the appropriate doses that you need because cancer is highly inflammatory. And we can use all the help we can in terms of taking products that decrease the inflammation in our body.
Absolutely. And you've got to be proactive. You cannot wait until it happens. Once it happens, it may be too late.
Absolutely. Now, tell me a little bit about magnesium and how important that is as an additional, perhaps, supplement. We can, as individuals, get, like you said, bombarded with supplementation, and we're talking about really streamlining what's most important, particularly as a menopausal woman, perimenopausal. And so we've talked about how important fish oil is, vitamin D, as well as probiotics. But I understand magnesium is very important too.
Magnesium is super important. There are 300 different functions in your body that depend on magnesium. And there's a lot of foods that are high in magnesium, so you could definitely try to get some of your magnesium from the foods. And the reason I say some is because, unfortunately, we have managed to drain the earth from good nutrients. So not completely, but the dirt may not have as much as it used to have. Therefore, a good magnesium could really help you in the long run. One of the magnesiums that I recommend, there's different salts. Basically, there's magnesium oxide, magnesium carbonate, magnesium orotate. My favorite is magnesium glycinate. Magnesium glycinate has got a great absorption, and it actually gets to the cellular level better than some of the other magnesiums. Remember, if a magnesium gives you diarrhea, usually that indicates that it's not absorbing as well as it should. And you don't want to overdo magnesium, but really it's hard to overdo it. You could start with 250 milligrams and then kind of build up on that and go up to see what your tolerance level is. Also take magnesium usually at bedtime because it's got a relaxing benefit on you, and it relaxes the muscles, and it may actually help you sleep better.
Well, that's a really great information. Now, Dr. Green, the magnesium that is phosphorylated and best absorbed in your professional opinion, is that one that you can buy over the counter as well, this particular type of magnesium glycinate?
Yes, you can buy things over the counter. I'm very particular and picky about what kind of supplements I recommend. Therefore, what I usually do is I go through a web portal called FullScript, and I actually put my patients in with specific recommendations because these are usually the companies that have a lot more studies and a lot more testing on their products. So when it comes to supplements, not all supplements are created equally. There are some that are made just in big batches and not really much overseeing or testing done on them. And there are some companies that actually do go that extra mile and try to do testing and provide to us that the products are clean, no contamination. There's no additional things that we don't need as far as even the fillers that's in the capsules or the tablets. That's really important. Some of those companies that I usually use are Designs for Health, Pure Encapsulations, Orthomolecular, Metagenics, just to name a few. Those are all good. But these companies usually don't sell to general public unless if your provider, such as yourself or myself, we put you in the system, or we give you the code, and that opens the gates for you to actually go in and purchase.
Well, that's really fantastic information. Dr. Green, I know that you do consultations, you even do telemedicine consultations. That's amazing. How does an individual connect with you if they would like to find out more information and get a hormone consultation? How do they do that?
The best way would probably be to either email me, or you're welcome to text me. Texting is 602-345-1473, or emailing me would be at azhormonehelpers@hotmail.com.
All right, awesome. We do have several questions from our Facebook Live viewers, which we will get to on our next segment as well, as we are out of time for this one segment, but I want to talk more about adrenal fatigue and your Fab-U-Vag natural moisturizer when we come back, and we'll be right back after the break.
You don't want to miss what's coming up next, because Dr. Nancy knows. We'll be back in a few minutes.
Hi, I'm medical celebrity doctor, and this is Dr. Nancy Knows Radio Talk Show. If you are a business and interested in showcasing your business on one of our segments on the show, to tell the viewers, listeners, who you are, what you do, and why we need to engage in your business, then contact us at drnancyknows.com. Fill out the form to be considered. Now accepting sponsorship request. Remember, it's not only what Dr. Nancy knows, but it's who she knows.
Hi, I'm Dr. Nancy. Welcome to our clinics. We believe that personalized care and relationship building are the basis of improving health outcomes. At Dr. Nancy's Integrative Medicine, you gain healthcare providers who take the time to understand your health goals and find solutions. We offer optional medical memberships, giving you peace of mind and quality care. We provide both medical and aesthetic services in 2 Arizona locations. We practice the highest standards of patient care. We respect patients' rights. We safeguard patient confidences. We treat patients with compassion. You are invited to call the office to schedule an appointment, or online at a time that is convenient for you. Call to schedule 480-669-6452 or visit our website at drnancysintegrativemedicine.com.
Hello, this is Dr. Nancy's Integrative Medicine. We are offering health screening examinations to include a physical examination and blood work, such as CBC, chemistry, lipid panel, and A1C for $199, valued at $600 to the first 10 people who call 480-669-6452 or schedule online at drnancysintegrativemedicine.com by January 15th.
You're listening to Dr. Nancy Knows Radio Talk Show. Ask your questions now. Dr. Nancy is listening.
Good morning. We are back with Dr. Sharzad Green. She's a clinical doctorate pharmacist specializing in compounding pharmacy, sexual dysfunction, and adrenal insufficiency, along with bioidentical hormone replacement. Dr. Green, thanks for being on the show today. Thank you. Can you repeat slowly the text number of how the audience could get a hold of you with regard to a consultation, please?
02-345-1473.
Awesome. Now, I want to just summarize a little bit about what we just talked about, specifically as it related to magnesium and how important it is. And not all formulations are created the same. And there are more palatable ones. And Dr. Green, you recommended either magnesium orotate or magnesium glycinate, correct?
Correct.
And it has beneficial uses for depression, hypertension, sleep, muscle cramps, and soothing of your muscles as well. So that's a nice supplement that all parties can really benefit from as well.
Yes, magnesium is really important. And sometimes it is in combination with other things. So you don't have to take magnesium by itself. If your calcium contains magnesium, that would be good too.
Perfect. Now we have a question from one of the Facebook viewers, and it's a young lady that is in surgical menopause, and she wanted to know what your advice was on pellet therapy.
Pellets have been around for a long time, over 20 years, and I'm very familiar with them. So for those of you who don't know what pellets are, basically they are compressed hormones, like imagine the size of a grain of rice. And they put all the estrogen or all the testosterone in that compressed grain. And then they make an incision on your buttocks and insert the pellet inside, and then close that incision and allow the hormone to dissolve and basically go through your system on the premise that your body is going to start using the hormone gradually and over a long period of time, meaning 4 to 6 months, and your level is going to be constant. So the thought and the premise of pellets is a very good one. And in a perfect world where it would work that way, it would be perfect. The problem is that I see patients who've got pellets who've had side effects from them, or their levels have gone up tremendously because all of a sudden the pellet gets released and the level goes up. Mm-hmm. And when that happens, then the patients have side effects from too much estrogen or testosterone, but there's no way that we could go in and dig out the pellet. So you're stuck with that until the level comes down. I've had many patients over the past 20 some years coming to me with the same problem. And for that reason, one of the reasons I don't like pellets is because of that, because I see that sudden rise in the level, and then that causes you to kind of go, shift from too much until you have to wait for too little. Over time, though, as they keep giving you pellets to keep and maintain your level high, I have seen very high levels of testosterone and estrogen that, in my opinion, are very unhealthy. Mm-hmm. So I advise caution when considering pellets. And if you have any specific questions, feel free to contact me, because not everyone is the same. Pellet therapy may be right for some, but in general, I don't recommend it because I like to have control over the hormones that I give to a patient.
Very good. And then typically in a hormone panel, for male or female, and you treat both male and female, what would be typical lab studies for a hormone panel?
I usually like to have a baseline level on estradiol, which is one of the main estrogens. I like to check estrone as well. Then I usually check FSH, or follicle stimulating hormone. If the patient is still menstruating, LH might be helpful. Progesterone is the other thing. Free and total testosterone, DHA sulfate. I usually check vitamin D, 25-OH, and I like to check the thyroid function, such as TSH, T3, and T4, because so many times the symptoms of hypothyroidism or even hyperthyroidism at times could be similar to menopausal symptoms. So you really want to make sure that what the patient is experiencing is not because of their thyroid, or sometimes it's both.
That's exactly right. So very, very good. Okay, awesome. Let's talk about your creation, Fab-U-Vag, and what is it used for, and how can people get it?
One of the things that I failed to mention is that at the same time that I met my mentor, my mom had breast cancer. She had been using the regular commercially available hormones. This was 20 some years ago, before I started doing bioidenticals. And she ended up getting breast cancer. So my mom has been the wind beneath my wings, always encouraging me to try finding something for those women who cannot or don't want to use hormones. Along the way, I always look for studies on things that are not exactly pharmaceuticals or hormones that are prescribed for women who suffer from menopausal symptoms. And when I saw this study on the effects of phenovaginal cream on vaginal dryness, that's when I got busy and started formulating FabuVag, which is a natural vaginal moisturizer. It's a very mild cream that you apply vaginally every day for 2 weeks, and then after 2 weeks, you can cut back to 2 or 3 times a week, and that usually maintains the moisture in the vaginal area. But an interesting thing happened because my patients kept telling me, oh, this is helping me in my sexual experience. And I was not aware of such experience or study until one day another study came out after I had actually launched FabuVag, showing that FabuVag or phenovaginal cream could actually help enhance a woman's sexual experience, such as libido or sex drive and ability to reach climax. So that was a definite bonus. It was such a pleasant surprise to have. Now we're promoting FabuVag for both dryness and sexual experience.
Well, that's a wonderful thing. Wow, that's really great information. And then adrenal fatigue. Briefly, what are your thoughts as an expert on that, and what symptoms can an individual be experiencing that would be adrenal fatigue?
Adrenal fatigue is an old term that was coined by Dr. Wilson. By the way, he was the one that I learned about adrenal fatigue from. He's a guru in that area. Now we're trying to change that term to adrenal dysfunction, or there are other terms that are being used. But essentially, adrenal fatigue refers to when our adrenal glands get exhausted from too much stress. Let me go back a little bit. Adrenal glands are on top of your kidneys, and they help you get through stressful situations. That's part of what they do. Of course, they do other things too. But as a person goes into a stressful situation, adrenal glands produce a lot of different hormones and chemicals, cortisol and DHEA, to help us get through that stressful time. And usually, once the stress is over, things calm down and we go back to normal. But if the stress is too acute, too high, or it continues on for a long period of time, that's when we may actually face what we call adrenal fatigue, which is adrenal glands kind of cannot keep up with it. Or now we believe that maybe that's just a reaction, that they're trying to say, no, there's something wrong. So they don't respond to the stress like they used to. Mm-hmm. And as a result, we see a lot of different symptoms. The 3 things that I look for just in general in a woman with adrenal, or a man for that matter, with adrenal fatigue is fatigue and tiredness, difficulty sleeping, and then weight gain, especially in the midsection. To diagnose adrenal fatigue, we have kits that are saliva kits to measure cortisol 4 times in a given day. Usually the one-time cortisol that's done through blood, that's just not sufficient, because we want to see the pattern of cortisol throughout the day in a person before we decide what level of fatigue she has or he has, and then come up with a treatment.
All right, really great information. Again, if individuals wanted to have a consultation with you, either in person or virtually, I believe, how do they get a hold of you, Dr. Green?
They can, again, text me at 602-345-1473, or they can write an email, send me an email at azhormonehelpers@hotmail.com.
Okay, awesome. Very good. Now it's time for our segment called Boost Your Awareness, thereby increasing your health and wealth. And Dr. Green is going to stick around actually to give us some helpful tips on how to maintain an overall healthy and wellness mindset as well. Dr. Green, you have some tips for us today?
Yes, I do. Did you want me to talk about it now?
I do.
Okay. All right. I think a lot of women, and I'm one of them, we try to kind of save money and be mindful of what we spend our money on. And I'm guilty of that myself, where I have thought, okay, well, by not doing something, I'm going to save $1 or $2 here, and that would be good. I've learned that sometimes that's not the best strategy especially when it comes to our health. So when it comes to foods, for example, try to stick with more organic stuff. It's more expensive. If you can't afford organic stuff, then do wash thoroughly, rinse thoroughly, fruits and vegetables, things like that. The reason I say that is because in the long run, when we look at studies and when we look at the overall health of us, we see that our habits today affect our health in the future. And if you're not healthy to be able to work or be productive, then that's going to basically it defeats the purpose, essentially. The same thing with supplements. So if you think that you're saving $1 or $2 by getting this giant size bottle of fish oil that doesn't even specify what's in it, the breakdown of EPA and DHA, in the long run, you're not really doing yourself a favor. So I just want the audience to know that I'm not saying go spend your money foolishly, but be very diligent when it comes to investing in your health. That's my message. So invest in your health by eating healthy, by exercising, by doing mindful meditation, and taking the right supplements.
You're awesome. Thank you so much for being on the show today. And, I did want to mention that Dr. Green is a recurring expert guest on Dr. Michelle Gordon's podcast as well. And if you're interested in knowing more, Dr. Green is on Facebook, Instagram, I believe, as well as LinkedIn. Dr. Green, can you give us your identification of how individuals can find you on social media?
All my social media is at Dr. Green. At Dr. S. Green RX. So it's DRS Green RX.
Awesome. Thank you so much for being part of the show. Really, thank you so much.
Thank you. It's been my pleasure.
Thank you. And I do want to share with everyone some last information on this segment. Principles for getting what you want out of life. It's really important. And this is quotes by or recommendations by Ray Dalio. Have clear goals. Identify and don't tolerate problems that stand in your way of achieving those goals. Accurately diagnose problems to get to their root causes. Design plans that will get you around them. Do what's necessary to push these designs through to results. And then lastly, do these things with input of people who might see what you might be missing. Listen, we are just about out of time, and I do want to tell you all to stay tuned for next week's show. Saturday, we are going to have Mark Windsor of the Windsor Law Firm to talk about prosperity law. Can't wait to have him on the show to give us helpful tips on, how best practices in his field of industry has helped many of us in our community. Remember, it's not what Dr. Nancy knows, it's who she knows, and everybody have a wonderful, safe rest of your weekend and week, and we will see you back here on Saturday morning at 9 a.m. Thanks so much. Bye now.
Optimal health requires you to perform at your peak potential. Start today. Be the change you wish to see in the world. This was Dr. Nancy Knows. Thank you for connecting. We're waiting for you on our next broadcast here at EMR, E Motion Radio.